Everyone, my name is Jerry Rosberg, and I'm glad to welcome you to another installment in our continuing series of COVID-19 and vaccine updates. We've been doing these now over quite a period of time, every 2 weeks. I can see that the number of participants is climbing. We'll get started even as people are joining. Some of the latecomers will have the misfortune of missing my introduction, but I think that's going to be just fine. I mention that because, well, first of all, let me say that for those of you who've been here before, you'll see this is the same format as we've used in prior sessions. If you're new, let me just tell you quickly that we have three very distinguished panelists here. Donna Lynn, who is the University COVID Director, Melanie Burnitz, who is Senior Vice President and Head of Columbia Health, and Wafa El-Sadar, University Professor, and very importantly for our purposes, Head of the Public Health Working Group that has been so central to planning throughout this. These are the people on this panel who have the advanced degrees in public health and medicine, and we're glad to have them here to answer your questions. As before, if you have questions, please put them in the Q&A. Donna will moderate and we'll get to as many of these questions as we can. Those that we don't answer, that we can't get to today, still are very valuable to us. They help us understand what are the questions that are of continuing concern, where our communication efforts need to be focused. So even if we aren't able to answer them here, we do our very best to follow up with FAQs and with planning for future sessions. We have a quiz, always a special feature of these programs, but let me turn it over to you, Donna, for the quiz and your presentation.
Great. Well, good afternoon, everyone. It's great to see you. Jerry's selling himself a little short because there will be a number of questions. His expertise will be used, whether it's in the HR or general policy front. So as Jerry mentioned, we are going to start with a quiz. I want to remind you what we do subsequent to the quiz, which is very brief, which is there'll be an overview of where we are with COVID and vaccines, followed by what has traditionally been a very robust Q&A session. And then we have a survey at the end that I would encourage you to stay on for, just a very brief survey so we can understand how informative the session was and what we can do to improve in subsequent sessions. So we're going to start with a quiz. And I'm going to ask Robert, who is our behind the scenes person, to tee up the quiz for you, and it should take us about 5 or so minutes to complete the quiz. Great, and I will go over them briefly and turn to our panelists for a little bit extra explanation when we have a little bit of a tie or something close to a tie. And this one is a good one because we did just yesterday announce, and we'll go into more detail, that we will require students who are coming back to campus or who have been staying on campus, but as of the beginning of the fall term, all students, undergraduates and graduates, will have to be have gotten vaccinated. We'll get into some of the details around how that will work. The second question, when Columbia students are all vaccinated, I won't need to get the vaccine myself. Again, we have a great response to this. I will say that you should get the vaccine. So there is no question that we want to see everybody, faculty, staff, students, family, friends, etc., vaccinated. So that is false. Number 3, all states, U.S. states and territories have expanded vaccine access to anyone age 16 and over. That is true as of yesterday, April 19th. That it went into effect. It went into effect in New York several weeks ago. All right, so I'm going to take number 4 and toss it to Melanie because we don't have quite the majority in this one that we did in the others. So New York State maintains its requirement for international travels to quarantine upon arrival. Melanie, can you give us the right answer and explain when and how this happened?
Yes, actually the 24% who said false are actually the winners and the correct answers on this one. So this is an interesting one. So this was a recent decision by New York State to no longer require quarantine upon arrival in New York State from anywhere domestically or internationally. So this is where this one's getting a little bit confusing. It still recommends travelers to quarantine and still recommends that anyone arriving from an international destination be tested 3 to 5 days after their arrival in New York State, but there is no requirement for quarantine.
Great, thank you. And the next one, again, a little bit of a split. I'm going to ask Wafa to talk about what is called the New York variant, B.1.526. And does this represent 45% of the cases that are now being genetically sequenced in New York?
Yes, and that is accurate. I think that is true. I think the good news is that New York City has, over the past several weeks, has increased the numbers of isolates of the virus that they're sequencing, which is really important in order to give us a sense of what are the changes, which variants are predominating in the community. So they've increased the sequencing, and based on the latest data, certainly this variant is now growing over time and has reached almost half of the variants that have been identified and sequenced in the city.
Right. And Wafa, why don't you continue with number 6, because there's again a little bit of a disagreement on this one. 70% of the genetically sequenced cases in New York City, are they variants?
Yes, I mean every as you know that variants are essentially just viral isolates. But what's interesting here in this question is that there are specific variants that are called variants of concern or variants of interest. And these include the variant B.1.1.7, which was first isolated in the United Kingdom, and also the B.1.526, which was first isolated in New York. So between these two, actually, that comprises about 70% of all the sequences that have been sequenced in New York City. So now we have these two dominant variants in our community.
Great, thank you. Number 7, I'm going to turn to Melanie. The average COVID-19 infection rate amongst the Columbia campus community. Melanie, can you tell us what that has been? And I think we're all happy with the answer to this one.
Yeah, this is false. It has not been 4%. It's been significantly lower. If you go to covid19.columbia.edu on the homepage there, you can see our rates broken down by week, and we average below 0.4%. On the Columbia campus. And in fact, last week's testing, we were at 0.19%. And you compare that to the current weekly average in New York City, which is at over 6%. So please check those out on the COVID-19 page.
Great. And unfortunately, the majority of you are right on number 8, so that the recent US data is that we're seeing between 60 and 70,000 new cases, and unfortunately 700 deaths a day. The same thing with number 9. This is also a true statement. So we actually, and we'll show you this in the slides, about 78 million Americans have been fully vaccinated, either getting 2 doses of the 2-dose regimens or 1 dose of the 1-dose regimen. And then number 10, Wafa, I think even though the majority got this one right, we'd love to hear you talk a little bit about herd immunity.
Yes, I think this is a very important concept. And ultimately, in order to really suppress transmission of this virus, we need to reach a high level of what's called population immunity and herd immunity. And how do we get there? I think the one way we're aiming to get there is through vaccination. And that's the reason why we need to have high uptake and high coverage by vaccines. We will get some assistance by also individuals who've already had COVID, because some of them have antibodies, and some of these antibodies may also have a protective effect. But most importantly is the need to continue vaccination scale up so that we can reach more than 70% of individuals who are resistant to COVID infection.
Great. Well, thanks everybody. It's always great to see the participation in the quiz. We're going to jump to a few slides to set the table for where COVID is. You can actually go to the 3rd slide, which is a graph. Perfect. And then we have some questions we got ahead of time, as well as the questions that are starting to appear in the chat box. So just a graphic that I like to show. I know a lot of people like to use this to think about where are we, and as you heard about the 60 to 70,000 new cases a day, you can see that on the chart. You can also see what's been very concerning and more we're reading about, which is, you know, even though we were coming down a very steep mountain, we've essentially plateaued, if not seen, as you can see, a little bit of an increase in the waning weeks of March and into April. You can go to the next slide and we'll talk about New York. We have seen a slightly different trend, you know, not so steep a fall, a spike that we saw after many of the March holidays, but happily now a declining number, but a declining number that's still at about 5% of positivity in New York City, about 3% in New York State. You can go to the next slide. I like to show this one too because it shows differences across the city. The lighter you are, the less positive cases there are. And of course, Manhattan, very light, and even most of the Bronx, or a good portion of the Bronx now, light. But Staten Island and some sections of Brooklyn and Queens still showing up quite dark. You can go to the next slide. I also like to show you where we are in terms of hospitalizations here at the medical center campus. We had a long, low rate of hospitalizations getting well below 20 at one point at any given day. We jumped up, to 200 in early February, and we're down now to about 120. So still concerning, and you know, we would much prefer to see that steep decline in terms of the mountain. You can go to the next slide. And then you heard Melanie talking about testing, and this just shows you, I think, some results that we're very happy about. We monitor asymptomatic individuals who are tested across the campuses. Last week's positivity rate was 0.19, and cumulatively, it's been 0.39. So very different than the results, not the 4% and not anything like what you're seeing in New York City and New York State. You can go to the next slide. And then I'll wrap up talking about COVID and then move to vaccines to just show you in particular the two yellow lines that are highlighted. New York State's rate is now 2.85%. That's the lowest number since November 13th. So good news. And New York City 7-day positivity rate is 4.91%. And that is the first time it's been below 5% since November. So two good indicators, but still, you know, when you think about what we're doing on the campus, it stands out quite in contrast with the rest of the city. So let's talk about vaccines. And as you know, we are using all vaccines that have been authorized under an emergency basis, Pfizer, Moderna, and J&J. J&J is now on pause based on the recommendations of the CDC and the Federal Food and Drug Administration. We don't expect to hear anything for a few days, and so we are administering through the various outpatient locations that we have Pfizer, and we'll continue to do that. You know, I used to have a bullet on here that the demand exceeded the supply. We're actually seeming to get to maybe equilibrium, and we do have appointments available at our vaccine sites, and we're hoping that we can continue to get as many people vaccinated as want to get vaccinated. But nevertheless, face coverings, physical distancing, and 6 feet and low density are all going to continue to be part of our campus environment. We've got some good data on how many people have been vaccinated that are Columbia affiliates, over 12,500 that we actually know of. I'll talk about the vaccine mandate in a minute, but we suspect there are tens of thousands who have gone to other places because they're in other states or because of convenience or ability to get vaccinated at a public site. So, and then as you heard in the quiz, we did have a significant change, probably somewhat unexpected, I would say, that you know, the quarantine has changed with respect to New York State travel. So you can go to the next slide. And then a couple of data points around New York, the US and New York State. We've got, we mentioned 78 million people in the country have gotten 2 doses, but 211 million doses have been administered, and over half of the population have at least gotten 1 dose. You can go to the next slide. And then New York, a little less strong than the rest of the country, but certainly accelerating. We've administered 14 million doses, and that's about 42% of New Yorkers having at least 1, and 28% having completed the series. And as I mentioned, we do have locations on the Columbia campuses at Lerner Hall, at Morningside, at the Black Building here, at the Medical Center, and then 2 outpatient clinics that Columbia Doctors runs on 103rd Street and Broadway, and 1 on 51 West 51st Street, excuse me. And in the non-Lerner Hall sites, we do family members who we call patients. So family members, friends, anybody can come in to get those vaccines. They are all by appointment. They are not walk-ins, although at the Armory, again, on the Medical Center campus, walk-ins started this week. You can go to the next page. These are simply the ways to make an appointment online through the various portals. And then the last slide I just want to talk about briefly is the vaccine mandate that was promulgated yesterday for undergraduate and graduate students. We are providing the vaccine at no cost, and that's true for faculty and staff as well as students. We're also accepting proof that students have gotten that vaccine someplace else. If you got it in New York, you can download something called the Excelsior app, and your proof of vaccination is literally on your app. I can show you mine. Excuse me. And then obviously, when you got vaccinated, you do get a little white small card from the CDC, which indicates when you got your vaccines and your type of vaccine. Excuse me. So, and that will be accepted as proof. We're working on all the mechanics around how those will be accepted and recorded in our tracking systems. If you don't come back to campus as a student and you're fully remote, you don't have to be vaccinated. So, you know, this is designed to keep the campus safe and to allow us, as you saw in President Bollinger's letter in March, to really bring the campus back to full operations. Excuse me. We will have a process for exemptions. And then finally, a good number of people not only have gotten their vaccines perhaps in other states, but in other countries, and we will be accepting approved documentation for vaccines that were approved in the issuing country. So that's a little bit of an overview on where we are with COVID and vaccines. And I'm going to turn now to some of our questions. And again, a reminder to put your questions in the chat box, and we'll try to get to as many as we can. And so let's start one. I have one for WAFA, which is not so much about vaccines, but that is about COVID. This came in ahead of time, and it is a question about a department that is quarantining incoming mail for 4 days after receipt, and instructing staff to wear gloves, to open mail or touch any other documents. And the question is this necessary?
Thank you. And the answer is no, it is not necessary. I think early on in the pandemic, there was concern that there may be the potential of transmission by contact. And I think that's why measures like that are described in this by the person who submitted this question were put in place. And however, we have new guidance from the CDC recently released that affirms that this virus is transmitted through the respiratory tract, and that a lot of the rituals and deep cleaning and so on rituals that have been put in place are not necessary anymore. So it is fine to get the mail immediately and to read the mail immediately as well.
Right. And we'll also try to clarify that as we continue to send out messages to faculty and administrators. So thank you for bringing that up. I'm going to turn to Melanie. about a testing question. Melanie, the question is, I have a faculty member who will be teaching in the summer. He's fully vaccinated. Does he still need to be tested for COVID at Columbia?
And the answer to that is yes. Anyone who has not been on campus, regardless of vaccination status, will have an automatic red pass because they have not yet gone through our testing program, which includes a gateway test, that first test. So he will need to get that first test. And then anyone accessing campus right now, again, regardless of vaccination status, is included in our weekly random surveillance testing. And if any of you receive an email stating that you've been selected for that weekly random test, you are expected to comply regardless of your vaccination status, and failure to participate in that will cause a red pass to be put on your app until you do get that test. The reasoning being we are still monitoring the full prevalence across our campuses regardless of vaccination status, but as we see more and more vaccination, we will continue to look at that and change it as needs be.
Great. And Melanie, another question that we got ahead of time, is it likely that we'll be doing COVID testing in the fall?
So it is likely we will be doing some COVID testing in the fall. It is unlikely it will be at the exact same capacity that we're doing it now, because we anticipate more of our populations will be vaccinated, considering our students have a requirement now as well. But again, there are a number of factors that feed into how much testing we'll be doing, not only around vaccination, but around community transmission rates, around the variants. So a lot of modeling and prediction goes into this, and we will certainly keep everyone notified in terms of what the testing program will look like for the fall.
Great, thank you. And then I'm going to give you one more because they're all related. This question is that I hear that more and more people who are fully vaccinated still test positive and get sick. Will this be a barrier to bringing back to campus, bringing back in the fall, full campus life?
So as I think we've shared in previous forums, certainly even when vaccinated, no vaccine is 100%. But what we know about the vaccine is it does prevent severe illness, hospitalization, and death. So can you still get COVID-19 if you're vaccinated? Yes. Is it at much lower rates than if you weren't vaccinated? Absolutely. As we continue to see more and more vaccination, the actual transmission will go down as well. So you've got to put all of those pieces together, the same way we see every year with our flu vaccines as well. The more people who get vaccinated, the more we break those chains of transmission and the risk goes down. So the fact that we see infections in people who have been vaccinated is not surprising. It doesn't mean there's a failure of the vaccine programs by any means. And it certainly does encourage us to continue to push for as many people to get vaccinated as possible.
Great. All right. I'm going to let you breathe and turn to Wafa. In full disclosure, Wafa and I both ride the #1 subway train, and we have a question about the train. The person is fully vaccinated, and they've been vaccinated for several weeks. Should they still be wearing 2 masks on the subway?
I think for the time being, yes. I recommend that people continue to double mask when indoors, and certainly I consider the subway as indoors because you're in an enclosed setting. So that's still recommended. There was a reassuring article that was published just very recently based on research that was also done by the CDC investigators. And they looked at they asked people who were diagnosed with COVID-19, and they asked them about what they did, to try to understand where they probably got infected. And one of the important things from this study was that there are 4 risk factors were identified. One of them was that were associated with COVID-19. One is restaurants. Number 2 was bars. Number 3 were gyms. And number 4 were churches. That is going to these venues. The good news is that on the other hand, that mass transit was not identified as a risk factor. So I think, although this is reassuring, I still think that for indoor context, it's wise, particularly when there are a lot of people around, to double mask.
Great. And it's interesting too, because we were talking about cleaning surfaces. The subways went through this massive intensive cleaning, which I know they're still doing, but they are operating longer hours now. And I think partly that is, both responding to people coming back to work, but, maybe that kind of cleaning that was going on isn't as essential as we thought it was in the beginning. Jerry, I'm going to turn to you. We all knew this question would come to you. So it's your moment, and I'm in the process of hiring for positions in my department, and a candidate has asked whether or not we will vaccinate employees. And the person's indicated they're not willing to do that, and they want to know, where are we in our deliberations about this issue?
So I take it, Donna, the question is, will we require employees? Because of course we will vaccinate employees. We're doing that right now. So this is obviously a very, very important question. And I'd like to offer an answer to this, but I'm hoping that the others will also speak up on this issue, because I think it's so important. I think the plain truth is we haven't yet decided about what to do with staff and faculty and whether there should be a mandate. What we have decided is that we need a mandate for students. The question of faculty and staff remains open. It's under active discussion, and we'll have to come to a decision on this reasonably quickly, but we're not there yet. We're still weighing the considerations. If you're wondering why would we make a distinction between students on the one hand and faculty and staff, I think the first point to say in answer to that is we want everybody to be vaccinated. Our goal is 100% vaccination on campus, regardless of status. The question of mandating it, as opposed to merely strongly recommending it, is a little bit more complicated when it comes to employees than with students. We have a lot of history of mandatory vaccination for students, and that's why we've started there. Most of our peer institutions have reached the same judgment and are in the process of announcing mandates for students. Very few have yet gone to the question of mandating for faculty or staff, but we do understand that all of them, like us, are actively considering this. And I think there's good reason to expect that will be the trend going forward, but we're not there yet. Could I ask Donna, Wafa, Melanie? I'd love to hear what others have to say on that same point.
No, I think you've hit it. One of the distinctions maybe, and I say this may with a very big may, is that healthcare workers, are sometimes considered differently than others. But at this moment, there are almost no healthcare institutions that are mandating it. And I think to Jerry's point, everybody is taking a wait and see attitude, both around the authorizations of the vaccines and other issues. But Jerry, I think you got it spot on. There's not much to add.
Can I add one quick piece, is that with any vaccine mandate requirement, and again, as you've mentioned, we've done this for students on MMR, we've done this for students on flu, there is always a process for exemptions for those who have a medical exemption or a religious exemption that we do go through. So, whenever there is a mandate, there is still a process for those who are unable to get that vaccine for either of those two reasons, to ensure that they are still compliant with the policy by virtue of those exemptions when they are necessary.
Right. I'm going to answer a question because I love this question. This is a new staff member at the medical center who wants to get vaccinated. All you have to do is go on to vaccinetogethernewyork.org and you can schedule your vaccine. And you could even wander by the Black Building if you're on campus. And we have a waiting list that we do maintain. If throughout the day we have some cancellations, we have to use the vaccines by the end of the day. So you can use either strategy to get vaccinated. Thanks.
And Donna, I'm just looking at the schedule for the Learner site tomorrow. There are available appointments at Learner Hall tomorrow. So if anyone is on the Morningside campus tomorrow, please go on through the Columbia Health portal and schedule an appointment for tomorrow.
That's great. As I said, the demand and supply since December 15th, we've been complaining about the fact that the demand was greater than the supply, and now we're leveling out. So, Wafa, there's a number of questions about the variants and the vaccines, and rather than read through every single one, I'm just wondering if you could talk about that, and then also the sort of a second question that keeps appearing that we've heard a lot about is the booster shots that might be.
Great. I think there's been a lot of concern raised about the variants, and we've spoken about this before for a lot of different reasons. One is that some of these variants have been shown to be more transmissible, meaning easier to transmit from one person to the next. Some have been shown to cause more severe illness. And in addition, also there's been concern that some of the variants may learn how to outsmart our treatments or outsmart our vaccinations. We do have evolving data on some of the variants, and some of the data are based on laboratory studies and others are based on clinical studies, meaning actually testing the vaccine amongst people who are in a community where these variants are circulating. And I think in terms of the variants that are predominating now in New York City, the B117 as well as the B1526, is that there is no evidence as of yet that our vaccines that we're using now are compromised by these variants, meaning that there's no, that the vaccines appear to be still protective against these variants. So that's very good news. But at the same time, of course, we have to be vigilant because new variants can arise at any moment in time. And that's why it's so important to prevent transmission as much as possible. Now, the question of the booster shot, what people have called booster shot, is important because I think it's unclear as of yet whether for people who have been vaccinated this year, for example, will they need to be vaccinated in the fall like we usually do with annual vaccinations for influenza as one example. We don't know that as of yet. The companies that made the Pfizer, BioNTech, as well as Moderna, they have both have working on a new vaccine. It's not exactly a booster vaccine, it's a new vaccine that would then be administered potentially in the fall. And this vaccine has been produced to be active against specifically against some of these new variants. So we don't know the answer to this as of yet. We don't know how durable the protection we have from the current vaccine, how long it will last. And we don't know what's going to be circulating in terms of different variants in the fall, and whether this will, if these new variants are predominating, then there may be the need to get another vaccination in the fall. So stay tuned, a lot of unknowns still, but at this point, it is not clear that definitely a booster will be required.
And I'm going to ask you one more and then turn to Melanie on questions about international students. So the J&J vaccine controversy, we have a question about whether or not should someone get Pfizer or Moderna for extra protection if they got J&J.
I think keep in mind that the whole pause for J&J was not because of a question about its efficacy, how well it worked. It was because of a concern about a very rare side effect that was noted amongst individuals who were vaccinated with the J&J Janssen vaccine. So there's no reason to believe that there's any compromise in the effectiveness of the vaccine. And but on the other hand, there's now, and as you're well aware, there's a lot of discussion about this rare clotting syndrome that was diagnosed in now, I believe, 7 cases in the United States, amongst maybe 7 million cases who received the dose of this vaccine. And the CDC is going to reconvene its advisory group this Friday to look at the data again and determine what to do next, whether to continue the pause, whether to adjust the indications, who should be getting the vaccine. So we have to wait the guidance, but I would not have any concerns about the fact that this vaccine does work.
Great, thank you, Wafa. I'll answer one question, then I'm going to turn to Melanie, but we've had this question a number of times where you get, if you are getting two doses, should you get them where you are now? Should you come to Columbia to get them, or could you split? So the answer is you should never split. We have a pretty strict tracking system whereby we get dose 1s and they're matched with dose 2s, not with your personal name on it, but they're counted. so that if every person we gave dose 1 to showed up for their dose 2, we wouldn't have any extra dose 2s to give to you. So stay where you are and get 2 doses if you can, or come to Columbia and get 2 doses. There are exceptions that we're working on now where, you know, somebody got in a foreign country and they came here, but those are exceptions and quite extraordinary. So Melanie, questions about international students, and similarly, should international students get vaccinated in their home country prior to arrival? Or if they don't, are we going to require that they get vaccinated here and then quarantine for some period of time before they can participate in campus life?
Great question. So we continue to recommend that everybody get vaccinated wherever they can at the earliest possible date. So that's domestic or international, get vaccinated where you are with what is available in your home country, if that is the case. We understand that may not be possible for everyone and that we may have international students arriving who haven't had the opportunity to get vaccinated, and we will offer them the vaccine at the time they arrive. They will not have to quarantine for 5 weeks until they are considered fully immune because of all the other precautions that we have in place, including physical distancing, face masking, et cetera, and obviously, as we map out the testing program, we will take these kind of factors into consideration in terms of, do you need a different testing regimen if you're not yet vaccinated or in various stages of vaccination, and the other elements regarding campus access. But it would not be a prolonged quarantine by virtue of not having had access to vaccine.
Great. Melanie, I'm going to keep up with you. There's a number of questions about flu shots and about the Excelsior app. So one question is, will flu shots be required if you are accessing the campus this summer for the first time?
Yeah, so actually, because there is no longer very much circulating flu at all, we turned off the flu vaccine requirement last week. So that is no longer a requirement because the flu season is basically over. So for those who are accessing campus this summer, have not yet had a flu vaccine, there is no recommendation to get that vaccine done. And obviously you can't get a flu vaccine at the same time as your COVID vaccine. We would much rather you go ahead and get a COVID vaccine right now. We anticipate potentially having to look at the flu vaccine for the fall, but remember, flu season does come later. We generally see flu start to circulate early December at the earliest. So it won't be a requirement for arrival on campus at the beginning of the fall semester.
Great, thank you. Wapa, if people are vaccinated in other countries, but they want the US vaccines because they are perceived as better than the ones they got in their foreign country, is that okay? And is there any harm associated with that?
We don't know the answer to this question. There are a couple of studies that are ongoing of mixing and using different kinds of vaccines in sequence. So hopefully we'll have some data to answer this question in the future. But we don't know as of yet whether there's maybe any side effects or any harm experienced by doing the sequential, or whether there'll be an additional benefit. That also remains unknown. But I would anticipate that over the next 3 to 4 months, we will have some answers to this question about mixing and different kinds of vaccines.
Great. Wafa, a number of people have also asked about when can they take off their masks. They've been fully vaccinated and, I guess they're tired of wearing their masks. And so what's your sense, whether double masking, single masking, when can people do that?
Well, I think at this point in time, at this exact point in time, with the current situation as it is with transmission and so on in the city, I think it should still be recommended that to double mask indoors. I think that's a good idea, unless you're in a room by yourself with a closed door. Otherwise, it is recommended to double mask in those contexts. I think if you're outdoors, again, one mask is sufficient. So again, that's what's recommended at this point in time. I think there also, as you know, that the CDC has also given some leeway in terms of recommending or suggesting that a small group of individuals who have been fully vaccinated, all of them, can come together in small numbers in one household, in one setting. That's kind of was the beginning of opening the door a bit to giving a little bit of leeway for individuals who've been fully vaccinated. Again, small groups in a household kind of a social setting.
Thank you. We have a question that follows on that. If you're vaccinated, should you be able to eat at a restaurant, indoors and outdoors?
Well, personally, I'm a believer that we should still restrict eating at a restaurant to outdoors, and also I warn people. Sometimes these outdoor restaurant spaces feel very much like indoor outdoor. So I would say be selective. You should go to a place that there's a circulation of air, there's air movement, it's not confined, a truly outdoor space. And also I recommend that if you're not eating or drinking, keep the mask on, and I think it's for the benefit also of the people who work at the restaurant as well. For the time being, I think it is premature to go indoors for a restaurant, especially as now the weather is getting better, and hopefully there'll be more opportunities for dining outdoors.
Great, thank you. Melanie, we have a number of questions about flying on airplanes and people who are concerned about whether it's safe. Some airlines are packed. They're not leaving middle seats free. Could you share with us your recommendations on flying?
It's still very complex. So I think there's a couple of things. If you have been vaccinated, obviously you're at lower risk. Certainly masking is recommended, as Wafa shared, double masking or using KN95 masking, which is shown to, again, be more protective, but airlines are not using reduced capacity and keeping your mask on during flying. Airplanes in general have good circulating air, as Wafa has just described. But obviously, you've got to kind of weigh up your own personal risk, and we continue to recommend deferring non-essential travel.
We always say in these webinars that it's not just the time on the airplane itself is what happens in the airport and getting there and going through security. So just keep in mind all of the different steps that are involved in travel, not just as the time on the airplane. I think I would be cautious at airport restaurants, for example, for some of the same reasons that we just talked about.
Great. And I think there are a number of questions about, if everyone is vaccinated, whether they're faculty, staff, or students, should they be taking their face coverings off, in a study group, in a conference room? And I think you're hearing a resounding message that we really shouldn't, that it is the safest right now to continue to wear your face coverings.
I think it's, I would say, for example, several people have pointed out, like in Israel, for example, they've recommended people not have to wear their mask outdoors. That's a very special situation because you have two things. You have very high uptake of the vaccine. Almost 50% of the adult population is vaccinated. So that's fantastic. At the same time, there's also is evidence that the epidemic is controlled, meaning that there are very low numbers of cases. So once you have both of these factors are met, then I think it is appropriate to say in an outdoor context, it is okay to remove the mask. But we have a ways to go until we get sufficient uptake and until we get low enough numbers of cases in our community.
Great, thank you. I'm going to turn to Jerry with a slightly different question, but again, one that's right in his sweet spot. And that is, we have a question about the return to campus or what the fall might look like, particularly in terms of administrative employees, and will fully remote continue to be an option?
It may be in my sweet spot, Donna, but it's still a tough question. I think there isn't a single answer for the whole university. We are very, very eager to get people back. I think that's the baseline. We want the campus to be vibrant and alive, and we want people here doing their jobs. I think there is still some uncertainty about how this is going to work out in the fall. We don't know exactly what the condition of the pandemic is going to be and the distancing requirements. But more important than that, there is still a lot of effort going underway at the school and department level to plan for the return, to think about what is the safest way to bring people back. So some employees may come back in a hybrid model. Some may be asked to continue working full-time remotely. We know that many employees have strong preferences about this, some eager to come back, some eager to stay away. But in the first instance, it really has to be your unit, the unit where the administrative employee works, who thinks through the question of the function of the employee and how that function can most effectively be discharged. So I'm afraid, imprecise answer to this is that most people will be back by the fall and working full-time on campus as they did before. But there will be, I expect, numbers of people who continue to work remotely, either full-time remote or in a hybrid way. And I don't have any better advice for you than to look to your unit for guidance and be patient with them, because the schools and departments are very, very intensively planning for this right now, and they'll provide information for you as soon as they can.
Great. We have a question about first and second doses, and I'm hoping it's a hypothetical. If it isn't a hypothetical, you need to email me or email Melanie. So the hypothetical question is, if you had the first shot but haven't been able to obtain the second shot, and you're approaching the maximum number of days where you should space between the first and second doses, WAFA, does this mean you have to start all over? And what are the consequences? And as I said, we'll move mountains to try to accommodate you to get this done if you're in that situation. So WAFA.
Yep, I agree. I think there is leeway. I mean, it doesn't have to be exactly on day 21 for Pfizer and day 28 for Moderna, but nonetheless, if you're in a situation where you way beyond that, I think my suggestion is contact Donna.
All right, Melanie, two questions, actually one right after another, which is about physical distancing. And there's been a lot of discussion about changing the 6 feet for elementary and for high schools. Is it still in place for universities and colleges?
It is. We have not gone down from our 6 feet and 50% density in those higher education settings. The data that came out that made the changes for the K through 12 is actually data strongly in elementary school age children. As you start to get into the middle and the high school ages, transmission rates are a little bit different. So all these agencies, CDC, the state, and certainly internally at the public health group, we're looking at the data as it emerges around that. But for now, we still maintain the 6 foot distancing.
We have a question on ventilation. And we've actually had a couple of questions about air conditioning and ventilation. WAFA, if you could talk about what has been done and how, I don't want to say essential, meaning it's not essential, but I think people were following up on the comments about surface transmission of COVID, had asked, what about air transmission of COVID?
Sure, and I think that it can tell you that over the past and since the beginning of this pandemic, facilities here at Columbia has been very active in terms of assessing buildings, all the buildings on campus, and doing a full assessment in terms of particularly in terms of ventilation, and what many of the filters, for example, that are in the ventilation systems have been replaced with filters that are able to capture more minute particles, meaning able to capture particles as small as this virus. So I think there's been an upgrading of the ventilation in the context of the COVID-19 pandemic. And I believe that on a website, there are almost like reports on each and every one of the buildings on campus. So you can also go and take a look at these to get a sense of what's been done at these facilities.
Great. I'm going to share a comment. It's not a question, but I think it's an important comment to hear. We have somebody who has commented that if there is no mandate for faculty and staff to get vaccinated, that person is in support of such a policy, or a policy that requires much more frequent testing for those who actually come to campus. Melanie, a question about, and as I said, there's many details we have to work out in terms of the student vaccine mandate, but we do have a couple of questions about medical exemptions, and I know you deal with that with the flu, and could you share what you might be thinking about with respect to the COVID-19 vaccine exemption?
Yeah, so we certainly do have a process whereby you require documentation that states what your medical exemption is, and we all follow the CDC guidelines around contraindications for the COVID-19 vaccine. There are very few contraindications to these vaccines, and certainly for different types of vaccines, there may be different contraindications. So we will be sharing what the process is, the form that needs to be completed, and the supplementary documentation that would need to be provided that are then reviewed. With any medical exemption, just submitting the documentation is not necessarily approval of that exemption. It will get reviewed by medical experts to ensure that it truly is a medical contraindication to the vaccine. And as I say, there aren't that many. And because you may have a contraindication to one vaccine, such as an MMR, that doesn't mean that you will have the same exemption for COVID-19 vaccine and vice versa, because they are different types of vaccines.
We have a question about wanting to know who's been vaccinated and who hasn't been vaccinated on campus. We have no intention of providing that information. It's actually a violation of privacy and HIPAA and a number of other laws, but we will be trying to both encourage vaccines amongst those for whom it's not mandated, as well as to, as the question was asked of WAFA, try to get to a general sense of the herd immunity in the Columbia community, but we will not be providing some kind of identification or other information on this. I'm going to take a break now. We are at 4:55, and I want to wrap up with a couple of comments and ask Robert if he would put up the next to the last slide in my presentation. A number of people have asked for the websites to be able to schedule appointments. So Robert, if you could put that up for a minute so people could be able to take down those addresses. We did have a question about walk-ins as well. We don't do walk-ins, as I mentioned, but both Lerner and the Black Building maintain waiting lists. And Melanie, maybe could you tell people a little bit about how that works?
Yeah, absolutely. You can send us an email and get added to the end of day wait list if you're near campus and can get there pretty quickly. We have a pretty robust waiting list, but I would say because there is adequate availability, your best option right now is to go to the website shown there for the Columbia Health Portal, and you can get an appointment for tomorrow. But again, if not, vaccine info, I believe the website is vaccineinfo@columbia.edu, and we can add you to our same day wait list.
Great, thank you. And then a couple of other reminders, and I'm going to turn it back to Jerry. This has been recorded. It will be posted on the COVID-19 website. We will have another one 2 weeks from now at the same time slot. And for any updates, just continue to check the COVID-19 website so that you can keep up with changes in whether it's vaccine policy or availability or its travel and the like. And as I said, we'll be providing you with more information about how to provide us with your vaccine information and some of the other questions that I know we didn't get to in our Q&A section. So a reminder to stay on to do the survey, and then I'm just going to turn it back to Jerry to wrap us up.
Well, thank you, Donna. No big finish from me. Just a quick comment of say thank you to Donna and to WAFA and to Melanie, and express again appreciation for all that the three of you are doing. It's so evident listening to you what good hands we are in here at Columbia, especially thanks to the three of you. So thanks all. Thanks to all of those who joined us today. And we look forward to seeing you again in 2 weeks. Undoubtedly, many new developments to report on by then. Thanks all.